Hi, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment here. This is the posterior horn of the medial meniscus. This compartment looks pretty good. The articular surface up above looks nice and smooth. The tibial plateau down below also looks nice and smooth. This is a pretty normal appearing medial knee compartment, so I'm happy with that. Here's the joint capsule here. The meniscus starts about here. And as we look underneath, that all looks pretty good. We'll keep looking here, but so far this is checking out great on the inside. Okay, so this is the central part of the knee. You have this wide open lateral side because the ACL tore so long ago. Probably the remnants of it are stuck here. The PCL is to the right, but your ACL tore, like I said, tore a while ago. So we don't really see any ACL tissue at all. And so this is where the new ligament's going to go. Of course, it's going to be a graft, but that's the direction it's going to go in. We don't really have to do much to open up. A lot of times we have to take away the old ligament first, but with you, that's already been done for us. So we'll get to work and show you some more in a little bit. Pause. Okay, so now we're looking in the lateral compartment. The most common place for the meniscus tears with this type of ACL injury is actually the posterior horn of the lateral meniscus, which is right back here. And I can already see that you tried to tear it. You can see where it gets a little bit, I'm just flushing it out. You can see where things get a little bit scuffed up right where the tip of that probe is. And so I don't see where it tore all the way through because I don't see anything on the undersurface. But that little spot right there, that's where people get meniscus tears when they tear their ACL. But that actually looks okay. It looks like you tried to, but you're young enough that it was, and soft enough and flexible enough that it didn't tear it. So that's good news. We don't have to fix that. But somewhere in here is where we usually have to pay pretty close attention. Let me turn on the outflow. So, and then the rest of the meniscus up here looks good. That little ligament you see back behind running up towards about 11 o'clock on the screen, that's the popliteus tendon. And so this is a normal area on the lateral side of the knee where there's a gap here. You can see my probe gets back there. It's not torn. That's normal anatomy. It's called the popliteal hiatus. And so this side looks good. So next we're going to look at the patellofemoral joint. And so this is the medial side of the knee. This is actually the medial gutter. That looks pretty good. We'll go off on the video and show you some more in a minute. Okay, so we're back getting ready to start making our tunnels in the bone. We have a nice wide open space. That's where we're going to be placing the new graft. We're using hamstring and we're augmenting the hamstring with a graft called Biobrace. Now we're going to take the tibial guide. We set it at 55 degrees just because that's where we like it in terms of the angle. Okay, so here you can see the sutures going across the knee. We're going to slowly pull them up, and what you'll see is the button's going to come up. I'm going to try and go slowly so we can see it. So there you can see the button. And as we pull on the green suture, actually we'll pull on the tape. And that's going to bring the button into position here. Shaver. And you're starting to hopefully get an idea of what this is going to look like. There's the new graft in position there. So we're going to fix the endo button and then we're going to fix it on the tibia. So we'll go off on the video. We'll probably come back up on the video one final time. But that's what the graft is going to look like there. Okay, so here's the new graft. It looks great. You can see how it runs there. And that's with the Biobrace augmentation. So I'm very happy with the way that looks. We're going to finish up here and get you back to the recovery room shortly, okay? So good luck to you now. Bye-bye.